Hi, and welcome to Every Artist Insured, Getting Affordable Coverage. This presentation is designed to help those in performing arts and entertainment understand all their options for health insurance in 2023. My name is Renata Marinero, and I'm the National Director of Health Services for the Entertainment Community Fund. My goal is to turn you into a health insurance ninja. We'll start by reviewing some basic vocabulary. We'll go over your rights as a consumer and talk a little bit about junk insurance, and then review how to estimate what may be variable income. In the second half of the presentation, we'll review Medicaid and Affordable Care Act plans and how to find the right coverage for you and your budget. Finally, we'll discuss how to get care and medications for free or at a discounted rate if you're uninsured. Let's get started. First, a word about who we are. The Entertainment Community Fund is a national human services organization that helps all professionals in performing arts and entertainment. We foster stability and resiliency and provide a safety net for performing arts and entertainment professionals over their lifespan. We have 4 main service areas, including social services and financial assistance, the Career Center, health services, and the Housing Resource Center. Check us out at entertainmentcommunity.org. You can also go to entertainmentcommunity.org/AHIRC and take a look at some of our healthcare tutorials. These are a series of animated cartoons, essentially, on important topics for our community, including what is Medicare, what is Medicaid, how to lower your dental costs, how to lower your drug costs, etc. Let's talk a little bit about vocabulary because we have to be on the same page when we're talking about health insurance. Most people know what a premium is. It's just a subscription to your insurance, basically. It's what you pay every month or sometimes quarterly just to have insurance. A deductible is what you pay up front for services before the health insurance company starts to pay their share, basically. You can have a deductible that applies to all of the benefits on your plan or only some of the benefits on your plan. If you have a deductible that applies to all the benefits, and let's say that deductible is $500, and you go to the dermatologist at the beginning of your plan year, and let's say that the dermatologist charges $250 for that office visit, full cost. You're paying that $250 right there. And if the derm says, you know what, you need a fancy cream, and you go to your local pharmacy and they say, here you go, that cream is $250, you're paying that at the time of service. Now you've spent $500 out of your own pocket for various medical services, and remember your deductible on this plan applied to all services and it was $500. So you've actually met or satisfied your deductible. It's like a hungry little monster that you have to satisfy before the insurance company pays their share. Now when you go back to the derm for a follow-up visit, you're not paying the full cost anymore. You've satisfied the deductible. You're paying what's called cost sharing, and cost sharing generally means copays or co-insurance. A copay is a flat fee, like $25 to see the derm or $40 for prescription medication. Co-insurance is a percentage of the bill, 20%, 30%, 40%. That's what you're responsible for. The insurance company is responsible for the rest. Copays are usually a better deal for consumers than coinsurance because with a copay you know what you're going to pay up front. With coinsurance, it's a percentage of the bill and you usually don't know what the bill is going to be when you walk through the door. The out-of-pocket maximum is the most that you'll spend in a year on medical care if you're insured and on an Affordable Care Act plan, or I should say one that plays by Affordable Care Act rules. So it is essentially a stop loss. In 2023, the out-of-pocket maximum for one person is $9,100. What that means is If you spend $9,100 in deductibles and copays and co-insurance, once you reach that number, you're not paying for anything else except your monthly premium. So it stops you from basically hemorrhaging money for, various medical expenses. Again, you have to be insured. You have to follow the rules of your plan, and the plan has to play by the Affordable Care Act rules. In-network and out-of-network relate to HMOs, EPOs, and PPOs, which are types of plans. An HMO and an EPO are types of plans where you go in-network only, which means they give you a list of doctors and labs and hospitals, and you have to go to those providers. If you go to somebody that is not on the list, then your insurance company is not covering you, and none of those expenses are going to go to your out-of-pocket maximum. A PPO lets you go either in-network or out-of-network, meaning you can see people that aren't on the quote list and still get reimbursed a percentage of what you paid. So it allows you more freedom. PPOs are also generally more expensive. The federal poverty level is what the government thinks you can live on, which unfortunately is pretty entertaining. It's a little less than $19,000 a year. So, I'm sorry, a little less than $14,000 a year. So I don't know anybody that can live on that in this country anywhere. The reason why I bring that up, though, is because what you pay in premiums will be directly related to where your household income is in relation to the federal poverty level. So if your household income is at 100% of the federal poverty level, you will likely in most states get free comprehensive insurance. That means you're making a little less than $14,000 a year. If it's at 200%, it depends on the state. In some states you'll also get free insurance, in other states you'll have to pay. But the federal poverty level determines what you're going to be paying in health insurance premiums. The marketplace and the exchange are the same thing. It's a website that you go to see what your health insurance options are and to enroll in them. And the advanced premium tax credit is just that. There's nothing Orwellian about it. It's a tax credit that you get in advance to lower the cost of your insurance premiums. And we will be talking about that in detail towards the end of the presentation. Let's talk about the rules and what your rights are as a consumer. Insurers can't refuse coverage to anyone or exclude pre-existing conditions. This has been litigated, 70, 80 times. It's still the rule. There's no penalty for being uninsured in most states, but there is a penalty in New Jersey, California, Washington, D.C., Massachusetts, Rhode Island, and Vermont. In those states, you will pay a penalty on your tax returns the following year. Insurers can no longer impose annual or lifetime dollar limits, and regulated plans must cover 10 essential benefits. These rules were all instituted by the Affordable Care Act. Most plans must cover certain preventive screenings for free, including mammograms, colonoscopies, and pap smears. Just a word about the difference between a preventive screening, and a diagnostic screening. A preventive screening is what you get regardless of whether you have symptoms or not. In other words, your yearly mammogram, your yearly pap smear. A diagnostic screening is what you get when you feel that you have symptoms, or your doctor feels you have symptoms. Preventive screenings are mandated to be free. Diagnostic screenings are not. They may be on your plan, but they're not mandated to be. Other things that are required to be free are routine blood pressure, diabetes, and cholesterol tests, your vaccinations. This is why your COVID vaccine is free, for example, immunizations, flu shots, and HIV and some types of STD testing. The Affordable Care Act also expanded Medicaid eligibility to people with incomes up to 138% of the federal poverty level, which means up to approximately $19,000 a year. That means that people in most states are going to get comprehensive free insurance if their incomes are below roughly $19,000 a year, except in Alabama, Florida, Georgia, Kansas, Mississippi, North Carolina, South Dakota, Tennessee, Texas, Wisconsin, and Wyoming. Unfortunately, in those states, they did not expand Medicaid access. Just a quick word about junk insurance. Don't do it. There are two types of junk insurance: faith-based share plans and short-term plans. These plans may be cheaper, but they don't have to comply with any of the regulations that I just described. Some red flags include anybody asking you for a membership fee for health insurance. You should never have to pay one. If it says it's not major medical, or if it says discounts of up to a certain amount, also red flags that this is junk insurance. What are the problems with these two types of junk insurance? Well, faith-based share plans are unregulated by any insurance department because they're not health insurance. That's why they're called share plans. It sounds like a nice idea. It's a faith community that gets together to pool their money. And if someone in that community gets sick, then the idea is that they pay those medical bills. However, again, very unregulated, and they don't have to cover pre-existing conditions. They don't have to cover certain benefits like mental health or hospitalization or drugs. Basically, they may pray for you, but they may not pay for you. Short-term plans are usually 3 months long or 6 months long, and the Affordable Care Act only regulates plans that are 1 year long. So that's how they get around the ACA guidelines. They're often sold by big insurance companies, and they'll do tricky stuff like they'll say, we cover hospitalization, but then if you look at page 98 of the guide that they send you, that they figure nobody will read, it says, we only cover hospitalization on Tuesdays and Wednesdays, which is not a joke. That is a policy that I've seen. So short-term plans skirt the ACA guidelines. We do not recommend that you sign up for these types of plans. You are better off going to the marketplace, which is regulated and where you can also get a subsidy from the government to lower the cost of your health insurance based on your household income. So when can you enroll? Well, for almost all states, open enrollment starts November 1st of every year and goes until January 15th of the following year. But some large states like New York and California have a slightly longer enrollment period. Your best bet is to check healthcare.gov to find the open enrollment period in your state. For most Americans, open enrollment is the only opportunity to enroll in ACA compliant health insurance without needing what's called a special enrollment event. So what is a special enrollment event and what is a special enrollment period? If you don't sign up during open enrollment, you can sign up outside of open enrollment if any of these things happen. You lose your union, job, or COBRA coverage. You get married or divorced. You become pregnant or are having a baby. You move to another state or county. You have a change in your immigration status, like for example, you get a green card, or you're turning 26 years old and aging off a parent's plan. In those situations, you have 60 days from the date of these events to enroll in other coverage. We recommend that you try to start that process 30 days prior to losing your coverage if you can, but you do have 60 days from the date of the events to enroll. If you don't enroll in those 60 days, you'll have to wait till the next open enrollment period, which again starts in most states on November 1st. Are there exceptions to these rules? Yes, of course, because why make it simple? So you can apply for insurance at any time if you're eligible for Medicaid, if you're putting a child on the child health insurance program, or if you're buying insurance for a small business. A small business for health insurance purposes is 2 or more people not related to each other. So what are your options right now? So the cool thing about what we do at the Entertainment Community Fund is we have a very broad overview of all of your options. So in most cases, if you were to go, let's say, to a private insurance broker, they would probably only tell you about your private insurance options, right? If you go to somebody that works for a government program like Medicaid, their job is to know about Medicaid, not know about private insurance. But we have the broadest possible overview, so we can tell you what all of your options are. And these are your options. If you had coverage through a job or union, you are likely eligible for COBRA, and we'll talk about that in a second. You can buy insurance directly from an insurance company. In most cases, we don't recommend this. And that's because you may be more likely to get junk insurance, and also you're not getting the benefit of any kind of subsidies from the marketplace. So the marketplace or the exchange, they will subsidize your premiums based on your household income. And if your income changes, they will change your premiums. You may also be eligible for Medicaid or some state-based programs, and by state-based programs, I mean programs like the Essential Plan in New York or Minnesota Care in Minnesota. Some states have added programs to help people at certain income levels. So let's talk about COBRA. COBRA is a law that lets you keep your employer or union-based coverage for 18 months after your qualifying event and sometimes longer. Usually you have 60 days from the loss of your job coverage to choose COBRA, but we are currently in what's called a national public health emergency, and that time period is waived. So while we are still in a public health emergency, you can elect COBRA at any time. You would have to back pay, though, to the date that you were first eligible for COBRA. COBRA is the full cost of your health insurance through your employer, and so it's usually quite expensive. If you want to sign up for COBRA, speak with your union or job-based HR department. What about enrolling in marketplace coverage or Medicaid? Well, first go to healthcare.gov, which will direct you to the appropriate marketplace website for your state. You can also request free comprehensive individual counseling and enrollment help from our navigators. We have fabulous navigators. They understand all of the options: private insurance, public programs, ancillary programs that help you lower the cost of your medications, etc. And again, they are free and you can get one-on-one help. You do need to fill out a form to request this assistance. So you would go to the website that you see here, entertainmentcommunity.submittable.com/submit. That's entertainmentcommunity.submittable.com/submit. And fill out the online form, and our navigators will be in touch in a few days to help you figure out your situation and help you enroll in something that works for you. So when you go to the marketplace, what is happening? The marketplace will determine whether you're eligible for Medicaid or a qualified health plan based on your household size and income. Please note that your household is anybody that you pay taxes with. So it is not, for example, a domestic partner or a roommate. Not all states can screen you for the Medicaid program. So some state marketplaces don't have that Medicaid integration, and in those states you have to apply for Medicaid at your local Department of Social Services. The marketplace will always screen you for your eligibility for advanced premium tax credits to buy a qualified health plan. Qualified health plan, or QHP, just means a regulated private insurance plan on the marketplace. Before you go online and fill out your marketplace application, contact your doctors and hospitals that you regularly use and ask what they're in network with on the marketplace. The reason why you want to be specific about the marketplace is because insurance companies have lots of different provider networks. So for example, if you get your Blue Cross Blue Shield coverage through SAG-AFTRA and you see that Blue Cross Blue Shield is one of the companies on your marketplace, do not assume that they have the same provider networks. They are likely different. Insurance companies create specialized provider networks for the state marketplace. So you have to be specific and say, what are you in network with on the marketplace? That will help you narrow down your choices on the marketplace and figure out something that your doctors are in network with. You're also going to, of course, have basic information about your household, your tax filing status, the name and addresses of any employers, your income information. We will talk about estimating your income in a second. And if you are an immigrant, then you need your immigration documentation because they will ask for the numbers on those forms. As I stated earlier, the Affordable Care Act mandated 10 essential benefits that you can see here: hospitalization, medications, office visits, diagnostic and lab work, the ER, x-rays and imaging, ambulance services, preventive screenings, mental health treatment, maternity care, substance abuse treatment, and physical therapy. Coverage of abortion now depends on state laws. So let's talk about calculating your income. This can be really tricky for people in performing in arts and entertainment because your income is generally variable or sporadic. So if you're applying for insurance in 2023, you have to estimate your 2023 income. And there are two ways to do this. The easiest way is to use your adjusted gross income from your most recent tax return. Generally, this is on line 11 of the 1040 form. So that means that you want to look for the term adjusted gross income on your tax return and then take a look at that number. If that number is, if you think that your income in 2023 is going to be within 10% of that number, then use that number that's on your tax return. However, industry income is variable. COVID threw a wrench in things. Your income in 2023 may not be anywhere near what your income was on your last tax return. So in that situation, you're going to use only what you know you will receive in 2023. That includes any W-2 income, which is gross, meaning pre-tax, your net self-employed income, which means you can deduct business expenses from your self-employed income, and any other sources of income that would normally be on your tax returns, like interest, or if you're getting unemployment benefits in 2023, you'd have to put that on there. Dividends, rental income, residuals, all that stuff that goes on a tax return. You need to estimate what that's going to be for 2023. You can exclude cash gifts up to $16,000. That is an IRS rule. So make sure that it's only what you know you'll be getting. You can always go into the marketplace and change and update your income. This is really important. So if right now you don't have any income going into 2023, maybe you just finished a job and you're not eligible for unemployment benefits, then you have zero income. And that's what you're going to put in your marketplace account. Now, once you get a job, once you get unemployment benefits, once you get some kind of income, you can go into the marketplace, change your income, and that will change your eligibility for programs, and it will also change what you pay for health insurance premiums. Let's talk a little bit about Medicaid. So Medicaid provides comprehensive health insurance at no cost to patients. There are no premiums or deductibles and very small copays, usually related to drugs. In most states, but not all, you can apply through your marketplace website. The pros of Medicaid are that it's extremely comprehensive, it's almost totally free, and it is accepted at all hospitals. The con to Medicaid is that it can be difficult to find doctors that accept it. We recommend that you watch our Medicaid cartoon at that URL. You can just type in into YouTube search bar, Medicaid and Entertainment Community Fund, and that cartoon should pop up. It's a really good 3-minute overview of the Medicaid program. Now, as we said before, not all states expanded Medicaid. What that means is that most states, 38 states, apply certain rules to your Medicaid eligibility. Those are the states that you see here in blue. So it is easier to get Medicaid in the states that you see here in blue. A lot harder to get Medicaid in the orange states. So who is eligible for Medicaid in the 38 quote-unquote blue states that you just saw in that map? If you're under 65 years old, your assets will generally not be taken into consideration. There are different eligibility guidelines based on your category. Categories are things like, are you a single adult with no children versus a parent or caretaker relative, for example. And also what your income is. So in terms of income, your annual income has to be under $18,755 for one person or $25,268 for two people. Or your current month's income has to be below $1,563 for one person or roughly $2,100 for two people, regardless of your income the rest of the year. So we're talking here about gross or pre-tax dollars. The method used, whether it's annual or current month, depends on the state you live in. In those 12 states that did not expand Medicaid, it's really hard to get it. You might want to think about talking to your elected officials. If you're under age 65, you must be very low income, be a U.S. citizen or legally present resident of the state, and fit one of these categories: pregnant, disabled or blind, parent or caregiver of a child, or child under the age of 19. Notice that these categories exclude adults who do not have children and are not disabled. If you don't qualify for Medicaid, you can always buy insurance on the marketplace. You can get what's called a qualified health plan. I can't tell you what it's going to cost, and that's actually a good thing because the costs vary greatly by the county that you live in, your household size, what your income is, what type of plan you want, whether it's a high deductible plan or a low deductible plan, the insurance company. It's all very specific to your situation. Most people right now are eligible for advanced premium tax credits to lower the cost of their premiums. These advanced premium tax credits are payments that are made to the insurance company. So in other words, if you fill out the application online and you find out that you're getting an APTC of $500 a month and you find a plan that costs $550 a month, you're paying the insurance company $50 and the government is paying them $500. If you're married, you have to file jointly to receive this tax credit. You can't be married filing separately. And if you make more money in 2023 than you estimated on the application, you will have to reconcile that on next year's tax returns. And you're going to owe the difference between the tax credit that you got at your income estimate and the one that you should have gotten at your actual income. So you're going to want to update your income in your marketplace account to avoid having to pay what's called a reconciliation on your tax returns the following year. It's not a penalty, it's a reconciliation, but it still can be kind of a nasty surprise. Let's talk about how you pick a plan. I see a lot of people on social media saying, give me the name of a good insurance company. Honestly, they're all trying to make money off of you. It doesn't matter what the name is or that you've heard of it before or that might seem like name brand insurance. You really need to be looking at 3 things when you're picking a health insurance policy. First, think about how frequently you use the healthcare system. take out a piece of paper and write down how you've used the healthcare system in the last 12 months. How many times have you seen a specialist? How many times have you had lab work? What's the cost of your medications? These things will all play a part in what kind of a plan you should be getting. Of course, think about your budget and also what your doctors are in network with on the marketplace. You're going to do that research as well. You can also, or should also, think about going forward, of course, if you have any major operations planned, if you're pregnant, that should play a role in the plan that you choose as well. There are 4 main levels of coverage. There's also something called a catastrophic plan, which is for people under age 30. The bronze plan is the lowest level of coverage, and it goes up, silver, gold, and then platinum, which is the highest level of coverage. Bronze plans are for people that don't believe in Western medicine and just want to make sure, for example, that they have something that has an out-of-pocket maximum. In case something bad happens, that they don't hemorrhage money on medical bills. So bronze plans are cheaper every month and they have high deductibles. Platinum plans are for people who make frequent use of the healthcare system, have medications that cost $3,000 a month, are, facing down a major hip operation, etc. They're going to be more expensive every month, but they're going to have lower deductibles and cost less when you go see the doctor. And silver and gold are in the middle. What you want to do when you're picking a plan is also look for plans that offer additional benefits or services that are not subject to the deductible. So when you write down that list of how you've used the healthcare system, it might say, for example, that you went to the primary care physician and that you had lab work done and then you got medications. Well, those are 3 services, and you want to pick a plan where the deductible does not apply to those 3 services. And always read the summary of benefits. They've made them much more straightforward now. It's generally, 5 or 6, 7 pages, but it's a chart. And it's very clearly laid out what you're going to pay in certain situations. Just a word about being uninsured. Don't deny yourself healthcare or delay healthcare just because you are not insured. There are ways to get healthcare. For hospital services, find lower cost, quote unquote, public or county hospitals. You can research those hospitals by going to essentialhospitals.org and clicking on Our Members. Those are hospitals that are mandated to see people who are uninsured and give them a discount on their services. You can also find community health centers that will see you on a sliding scale according to your income and get discounted or free prescription drugs at needymeds.org. I'm going to show you that website in just 1 second. And you can also compare drug prices at pharmacies at goodrx.com. So this is a screenshot of the Needy Meds website, and you can see on the left-hand side it says Save on Prescriptions, and below that it says Help Filling Out Prescription Assistance Program Applications. Those 2 categories basically, they reflect patient assistance programs that pharmaceutical companies have. So pharmaceutical companies get big tax breaks to give their drugs away for free to people who are uninsured and low income. And you can look up the name of your drug here, find out what the eligibility guidelines are for that program, print out an application, and then you would take that application to your doctor. They would sign off on it. You would mail it into the pharma company, and they would give you your medication, usually for free. You can also find low-cost or sliding scale clinics, including medical, dental, and mental health clinics, right below those 2 categories on the left-hand side. This is an extremely useful website. GoodRx.com is also very useful. So this is a website that will compare the cost of a medication at different pharmacies in your area. A lot of people don't understand that pharmacies charge different amounts for the exact same drug. So you can see here that Walmart charges a flat $15 fee for Lexapro, for example. Target normally charges $61 for Lexapro. Walgreens normally charges $177. Big difference for the same medication. Now, this website uses the zip code you're in, so this might not necessarily be the case in the zip code that you're in. You can also get discount coupons at GoodRx to lower the cost of your medications. So this is not a scam. This is a very common thing that people do. Again, pharmaceutical companies get tax breaks to give their drugs at lower cost to people, and GoodRx.com is a great place to go find those discount programs. That is it. I thank you very, very much for your attention. I hope this has been helpful. Check us out at entertainmentcommunity.org/AHIRC for all our health insurance related services. Take care, be well, and stay out of the hospital.